Welcome to the ToRAISE Questions Doula podcast. This is Melanie Headley. I'm here with Thérèse Hakoun. She's the executive director of ToLabor, which is the International Doula Training and Certifying Program. Hey, Thérèse.
Hey, Melanie. I was thinking, I just banged my face into the microphone, and I thought, it's a good thing this doesn't get filmed, because if they could see what I do, let alone what we do together, it
would not be good, especially our breastfeeding podcast. Yeah. That would be.
Yeah. All the hands on our breasts, you mean, squeezing over our nipples. Anyway, welcome, everyone. Glad everybody's here. And here we are in another week of summer. And I guess depending on where you are in the country, I mean, we're still in the thick of every single day in the 90s, and every single day I take a hike every morning, and walking back, my clothes, I'm just sopping wet, and it's only at the very latest 10 o'clock in the morning. Most of the time it's like 9 or 8:30 when I'm coming back, and I'll look, this morning I looked and the humidity was 61%, and it's like, oh my God. Ugh. When I see it go to 41%, I think, oh, no, it's such nice low humidity. And then I think about all you people out there who are in very hot weather but have 12% humidity. And I just want to go, oh, please enjoy that for me.
Yeah. Please bring us there for a workshop.
Yeah, that's it. Yeah. And then up north, it's starting to cool down already. Yes. So I don't want winter, but I'm done with hot, humid.
Yeah, the thick air is it just makes me so sleepy.
Well, what I realized is ever since I don't have small children ever since my children grew up, I realized I really don't like summer very much. I liked summer when the kids were young because I loved having them. I actually am one of those people that they drove me crazy, and I yelled at them and we yelled at each other. But I loved having them around, and I liked the no scheduling of things. And so I enjoyed that.
Oh, that's what summer is supposed to be like?
Yeah, sorry. And what we did was we spent all our summer in water, whether it was our community pool, the river, and or the ocean, which we did all those things all summer long, that I was always wet, in a not humid way. I was physically in water wet, and I didn't realize how hard summers were for me when that routine got broken. And now I'm a complainer. Sorry, I'm complaining on a podcast. Okay, we better move on.
Okay. We're going to be answering some of your questions, so keep listening. Be right back.
Hey, everyone. So I'm just going to move forward. We have a question from one of our listeners that we just thought was kind of a good topic as far as it's relevant to all doulas. And this is what she said. How do we speak to the realities of some hospital birth settings to the clients that we see routinely misled or lied to about what they can expect? I'm talking about the OB who says, yeah, great, a natural birth, no problem, but who doesn't actually support it from your experiences with that provider and their C-section rates. How can we prepare our clients for the realities of their birth setting? I've had clients tell me, I really want a natural birth at a hospital with terrible culture surrounding that with 50% cesarean rate. I find this topic tricky because while it is their responsibility to choose providers, I'm the one who sees more of what really goes on. Haven't we all been in that circumstance?
Such a good question.
Yeah.
It's such a good question.
And, here's my really simple first response to it. It is your job to present the realities. And that does not mean slamming somebody with, what are you thinking here? But that is what they hired you for. That is what we are responsible for. Not that we can make them change. Not that we can make them get it. Mm-hmm. But it is our job to say, here is what I know. I mean, so, Melanie, when you're in the circumstance, you have a client who is seeing a practitioner that they really like. They think, oh, they're really kind, or I've been seeing them since I've been a young woman for well woman care. That's a very common thing. Or they just like them. They happen to get them via insurance, and they like them. And they tell you that that's who their client is. Who their provider is, and that they've talked to them about how they'd like to have a natural childbirth, and they're planning to have a doula. Or they may not have even said that. A lot of times they don't.
If we're having an interview, I guess this is where that conversation would come up.
Yeah, but they what question?
It's hot. Did we already say how hot it is? And we're actually in a room with no air conditioning right now.
With no windows.
So you're saying if someone came to me and told me this?
Yes, they're saying to you, I have a care provider, and I've already talked to them about wanting a natural childbirth, and I really like them. And, they're satisfied. But that from your own experience working with that practice, or from the resources in your community, which we strongly encourage that doulas not badmouth providers, but share statistics and share anecdotal experiences.
Facts,
Yes, and facts and anecdotal, because anecdotal also doesn't always mean I'll come back to that. But they share their experiences and actual facts. And that provider is more than likely yesing your client than they are being truthful to the fact that they're going to support it in a way that really is supportive. What do you do?
Well, I would first of all, and I have this conversation all the time. This is a really, really likely first talk with a client, with a prospective client. First of all, I say, as a doula, my job is to give you all of the information so that you can make an informed decision.
Good. I think you learned that in the 2 labor workshop.
I think I did. And then I will, I will say, I just had an interview 2 nights ago, and she was second baby, first baby. She had an epidural at 7 centimeters, and they did not have a doula. This is a really interesting situation. Her doctor that she saw prenatally did not have privileges at the hospital she wanted to give birth in. And so she decided that she would stay with that doctor and go through prenatal appointments with her. And then when it was time to go into labor, she would drive to the other hospital that she wanted to deliver in and get whoever was on call.
How interesting.
Right. So, which is first how I put it. And then I thought, oh my gosh. Anyway.
Because you would have to wonder, what was her thought process there?
She felt safe with her doctor, and she felt like she could do it. She really did. And she really wanted to go to this specific hospital. She had heard better things postpartum about this hospital, and she liked the way it looked. She wanted to go there. So she did, and she ended up with a hospitalist who she only saw when she was crowning, and then he cut a nice big old episiotomy. The nurses there told her to buck up and calm down when she was going through transition, and decided that it was time for her to have her epidural, which she got at 7 centimeters. And her poor husband had no tools. They did not have a doula. They had not taken a class, and he had no idea what to do. And her labor, they showed up at the hospital at 10:30, and she had the baby at 3:45 in the morning. So it was not that long of a labor either. It was fast and it was intense. And so this time she wanted to have a doula to give her husband some tools and help them, but she wanted to stick with this plan, with going through with her doctor and showing up at this hospital. And
I just have to interrupt. I think It is so interesting to me. I just have to, I know I want to hear the conclusion, but to interject that I'm grappling with so many thoughts in my head. It is so obvious that she really wanted a care provider that she could trust and that she felt safe with, which is why somehow this was all making sense to her. That the prenatal care, though, she missed there was a disconnect that the prenatal care wasn't attached to the outcome.
Her provider had been her OBGYN for 10 years, so she had this connection with her. But I feel that the provider did her a huge disservice with not talking about.
But did she know what her plan was?
Yes.
The provider knew the plan?
Yes, the provider knew the plan.
Yes. Yeah. Okay, so go ahead. I'm so in shock by this story just
it's
because...
It's within the same practice, but that provider does not catch babies at that hospital. So she ended up with, if it were during the day, she would have ended up with one of her provider's partners, but because it was at night and that practice goes on to a hospitalist rotation for on-call at night and weekends, that's who she ended up with. Does that make sense?
Yeah.
It doesn't make sense, but it does make sense. So, what I said to her was, tell me what you want for this birth. I detail it out. How do you want this birth to be different? What are you looking for? And everything that she was saying, she wants to feel safe. She wants to be surrounded with people she trusts. She wants the nurses to understand where she's coming from at this natural birth. She wants to be able to get in the tub. She wants, she doesn't necessarily want the saline lock-in. All of these things. And I just said, you are such a midwife patient. You're a midwife patient for birth. And it's okay if you are a doctor patient for your well woman care, but for birth, you're really describing a midwifery birth. And so that really sparked her saying even more things that she really wanted to know. And I read about this. Would that be possible? Oh, and I heard this story. Would that be possible? And oh, another thing they did to me at the last birth, and another thing that they did that I didn't like. And by the end of the meeting, she was completely sold on switching. So she's now switched. She's hired me as her doula. And she's really getting excited, where before I think it was more gearing up for this.
The fight.
Yeah.
And who will I land with?
Right.
And it's interesting to me, and it's great how you
it's a
guided
weird story,
her. Well, it's so different than even what this listener is asking of us in some ways, but it's so interesting that even after that not good experience, she still wanted to go back to that hospital.
Right.
Which wasn't a excellent experience.
No.
So what made her think, that's what
brought her to hiring a doula. And so within that same talk, I said to her, the most important decision that you are going to make in this is your care provider. Hiring a doula is not going to save you from certain things.
And I think that's the point that I want to stress in this. It is really important that doulas be discussing with their clients who their care provider is. And this goes to the question and my answer already. It is your job to discuss the realities, and it's not bashing, and it's not if there's a way to do it. It's you did it that way, that it was a midwifery. You could see that as a midwife-led birth would have been better for this woman, and she could recognize that. Some people don't have the opportunity, depending on where they live. Like I was just teaching in Corpus Christi, and there are no nurse midwives in the hospital. The only way you could have a midwife is at home, though I think they did have a birth center, and Corpus Christi women can clarify that. So that wouldn't be, and not everybody wants to have a baby at home, and nor do I promote home to people. I want them to make choices of their own. It is important, though, that we know who the care providers are in our community, because there are doctors that will work with women who are more willing to okay, what do you want? Yeah, I can go with that. Yeah. And anyway, I always think this also. Well, I just think about how little time they spend with the woman, you know. So I do think the care provider is so, so important. I would agree with the woman that the facility is really important too. And I think the questioner is questioning that as well. There are some facilities where we know as a doula that they have a really high cesarean rate, and they have a really high induction rate, which is just about everywhere anyway.
And the policies are different.
And
so I would encourage women to go to their next appointment with that provider with a list of questions. Questions like, how would you facilitate the pushing phase? How would you facilitate my transition when I'm going to be asking for an referral?
And I agree with the way those questions, except for, because I think what you're pointing out is something I try and point out, not going in there and saying, this is what I want, because they already know what they want. And it's easy to say, a provider, it's easy for them to say no to that or yes to it, whether it's the yes is true or not.
Right.
I like them to say virtually, I guess, the same thing. It's more, and probably is the same thing. Like, tell me what you do when it comes to transition. Tell me what you do when it comes to pushing. Tell me what you do when it comes to, as soon as the baby is born, what routinely happens.
What is this going to look like?
Yeah, because then it's not a question of a yes or no. It's I want to hear what you actually practice. And I also say to everyone that then it saves you a lot of time too. Because if you agree with what they like, what they do, then you're like, oh, great, I'm in the right place and I don't have to go over my whole list of what I want, what I don't want. Then you've basically allowed the care provider to provide to you that information. And you go, oh, great, at the end, I agree. That's wonderful. I feel really glad that I've decided to be at this practice.
And then there are questions around the policy that you can ask, like...
Yeah, go ahead.
I don't know how to say it because I hate the can I. But...
What does your policy say?
What does your policy say on regard eating and drinking and labor?
Yeah, in regard to IVs or Pitocin administration. Right. But we had a whole discussion about this, and this has to be a whole podcast in itself. How do you actually find out what the protocols are in a specific hospital? Who do you contact? And if you live in some communities, they only have 1, 2, maybe 3 hospitals max that have do births in them. Some communities, in Richmond, what do we have? Like 7 different hospitals. I've lost count, but something like that. I was just talking to a woman who was in Houston, and she said, it was like 16 different hospitals to choose from. How do you, because it really matters also, your client needs to know just where they're going. But if they don't care for those policies that they hear, whose work is it to know all the policies at all the hospitals? And it's certainly not all the responsibility of a doula. But it is also really wise for a doula to know all the different hospitals, what their actual protocols and policies are. And why I bring this up, and that's why we really do need to do a podcast about it in more detail, is that it can be hard to get that answer, because protocols and policies aren't always the same thing. And I stress this. Do not, and I sound so terrible saying this, so please take it the way I mean it. Do not trust that the person who is telling you that this is the policy or this is the protocol, that it is the truth. And it's not that they're lying. It's what they've been taught themselves or how they were trained. So they think it is true, and it could be true, but your clients want to see the actual written protocols, which I was talking to, again, a nurse about this a couple weekends ago, and JCO, which is the overseeing body for hospitals, like the accreditation process, they require that for every department that exists in the hospital. They have to have policies and protocols besides the overall hospital protocol and policy. So it's a legality. You have to have this. And people will hear, here's what they are. They don't see the written stuff. Or, I don't really know how you can access those.
But you're very right about it changing from provider to provider within that hospital system.
But see, that's a difference. There are provider policies, and there are
protocol.
and there are hospital policies and protocols.
Right.
They don't always jive.
No, they don't. And that's where, I've been to births within the same hospital with different providers and seen the births managed very, very differently. And the excuse of it's policy being brought up. And I know that is not true.
Policy of the hospital. Yeah.
Yes.
I've heard that. And then you ask the hospital and they say, well, it's the doctor's policy. And what I came to understand is nobody really knows what the policy is. Right. It's just what I feel most comfortable doing.
Well, I think that's why it's so important to ask the provider, because then you know how that provider practices.
Right. I agree. But here's the problem with that. It's all a problem. Here's the problem with that. You can go to, the provider says that. The woman goes to the person goes to the hospital to labor. They get a nurse who is going to be there more than the provider is going to be there.
Yep.
And they're going to say, well, I can't do that because, one, it's the policy, and two, I could lose my job. And I think I shared this a long time ago on this podcast. I watched a nurse, and this was such an interesting situation for me as a doula to watch. The baby was going to be born soon, and there was meconium in the fluid. And the nurse said who was really a wonderful nurse to work with, said to the client, I just want you to know, since there's meconium in the fluid, we will have to call in the NICU team just to be here. Not that they're going to be needed, but it's just our policy. They will be here in the room. And that was the policy that she had been trained as a nurse working in that hospital that she must follow through with if that were the situation.
Okay.
The doctor looked at her and said, what did you say? And she said, well, I'm going to call the NICU. And the doctor said, no, we do not need NICU in here. We do not need NICU in here. And she said, but I'm supposed to call them. And the doctor said, we do not need the NICU team in here. You do not call the NICU team. Which, on the one hand, as the doula watched for the support of the woman, I was like, yay, doctor. Yeah, we don't need that. This is not a situation, the baby wasn't showing any signs of distress. Right. The care provider was a trusted care provider that figured was not going to make that call if they thought they couldn't do a good suctioning of the baby or take care of it. But I watched this really wonderful nurse she was stymied at the moment because she had a protocol she had to follow. And yet the doctor was telling her not to follow it. And she has a license and a job. And she was caught. And in the end, she didn't call the NICU. And we didn't need the NICU team. So everything turned out okay. But if it hadn't turned out okay, would the doctor have said, I told her not to call?
Oh, that's
and
so tricky.
Even if they had said that, what would have happened to that nurse because she didn't follow the protocol? So it's a really hard situation. Oh God, I just made more of a problem for us discussing this, isn't it?
Yes,
really hard.
It's hard.
But going back to your question.
Well, and we can get stuck in that, hospital policy talk for sure. But
yes.
And not that your client needs a written policy from each hospital in their community. You really can go on statistics and facts and anecdotes when you are talking to your clients. But, some of the things that I will say when I know that they are with a particular practice or physician that is not going to practice that way, is just yesing. And then when it comes down to it, they're going to be induced at 40 weeks and 4 days.
And I think that's what our listener was asking about.
Right. And so, having them ask the questions like, what happens if my water breaks at home and it's clear and I don't have contractions? Do you want me to come in right away? These are kind of like red flag questions, is the way that you practice, is that going to bring me in?
And what I wouldn't do in that question is I wouldn't give the answer.
Exactly.
But I wouldn't say, do you want me to come in? Will you want me to come in? If my water breaks at home, without contractions, what is your policy around that? What do you usually do? If it breaks at home and I do have contractions, what do you usually do or recommend? Don't say, do you want me to come in? Because then the care provider more than likely will say, yeah, come on in. Or they might have said that anyway, but you don't give people answers unless, I have a trick of giving people answers when I want the answer that I want. But when I don't want the answer, I want to honestly hear their answer. I don't give them suggestions. I just ask the question. So I think...
So that would be a good question.
Yeah.
What's your monitoring like? Wireless fetal monitoring is really ideal if that's an option in your community, so that you can have your client in lots of different positions during labor and not have to get out of the shower and come to the monitor. But
we always want, you're talking about those still intermittent monitoring.
Yes.
Yeah, because my issue with wireless, and for those, I think most people are aware of wireless monitoring, but not all facilities have wireless. Right. But when people hear about a wireless situation, they're like, God, that's so great. Hospitals should all have those. And we agree they should have a few of those available for somebody who is intermittently needing to be monitored while they're in the shower.
Intermittently.
Or they're on Pitocin and they need it. Yeah, they have to be continuously. But this will give them the freedom to get into the water and movement. But I don't want a hospital to have 15 of those, because then they would say, well, you can have freedom of movement.
Right. And if you do have them, then what is your policy?
Right.
Right.
Because if they have them and say, you can have freedom of movement, then they would say to everyone, well see,
let's just keep it on
all the time.
Yeah.
There's no problem with it.
No.
Yeah, so those are good questions for the care provider. So you as a doula, you are trying to... I think I have no problem doing this. When a client says, I have chosen Dr. X, if I know Dr. X, it has a reputation, not only statistically, but anecdotally, or I've been witness to those experiences, I will say, well, from my experience and from others, my understanding, though that care provider can be, probably is no doubt a decent human being, when it comes to the kind of birth you are looking for, they are not supportive in reality of that experience they have. And so it's important that I share that with you. And what do you think? What do you feel? What questions do you have about that? Then put it back in their lap to discuss with you how they feel. I mean, we've all had the experience of trying to shed the light with a client about their care provider, and they just get stuck. They don't want to make the change. And that is the other reality for you as doulas, is to understand you can't make them change. But for the listener, it is really important that you educate your clients. I mean, that's what they're hiring you for, your knowledge.
And I like putting it back onto them. So it's not just you saying, no, don't go to them. That's
right. No.
That's why, it's why I want to give you questions to give to your clients so they can go back and ask those providers and they can make their own choice.
Right. And it's really how they ask those questions that are important. We've shared this one where a client will say, when do you do episiotomies? And the care provider says, only when I feel they're necessary. And so the client feels really reassured by that. And that may be justifiable that they feel reassured. But we want them to ask, when do you find it medically necessary? What would be a situation where you felt it was medically necessary to do an episiotomy? And they may get an entirely different answer.
Yes. Because
they may think it's necessary all the time. They don't even think it's not necessary. They might say, well, I feel it's medically necessary if I think you're going to tear. And then the woman has to go the next step with that. Like, well, what is the problem with tearing versus being cut? Because if I get cut, then it definitely has been cut. And we don't know for sure I would tear. What is the difference, and why would you want to do that and not see even if I tore, what difference does it make?
And what if I would rather tear?
Yeah, which is an interesting thing for a woman to say to a care provider. Well, I would rather tear than be cut.
Yeah.
And see their reaction.
Conversation with my care provider with my first baby, and he did it, and I did tear a little bit. But yeah, that is, just the way that you frame these questions is so important.
It's helping
to really get an answer the way that you need to, that they need to hear it.
Well, and going back to the person's question specifically, I'm looking at it right now. It says, because while it is their responsibility to choose care providers, and it is their responsibility, but it is your responsibility to help them make informed decisions. And that's where you can take it out of the tricky part. You can't force somebody, but you should be making very clear to anybody who is considering hiring you before they hire you that your job is to give them all their options, all their choices, all the alternatives, to help them formulate questions, how to negotiate things. You are not their spokesperson. You are their guide. And if they want this, then that's what you want for them as well. And you're investing in that. You want them to invest in it as well. So, anything else?
I think that's really good. I think it's also about empowering your client.
Well, totally. I mean, that totally, man. Yeah, it is absolutely, because oh God, I love when people like your client that you just mentioned had this awareness that they actually had a different choice, that they had not a bad, like a trade-off, but a actual equal, if not better choice that they hadn't been aware of. And you see how that excites them and how powerful they do feel. And then in the end, as we have shared over and over again, I have never, and I would think that you would agree, had anybody who changed who wished they didn't change. Care providers.
True.
I've never heard anyone say, gosh, I wish I had stayed with. And instead they feel triumphant. They feel like, and that goes a long way to who they are long term, of not being afraid to make a change and not being afraid to question things and look at their choices. So.
And, I've had the conversation with people too, where it sounds like a lot of work. to change.
Always. That's the biggest thing, especially.
I've got to call my insurance. I've got to and I feel badly for leaving this provider.
I don't want to hurt their feelings.
And, that came up a little bit with this last client. And I said, it is work, and it's important work.
Mm-hmm.
And birth is hard work.
Mm-hmm. Good.
And it's important to do most of the hard work on this side.
Yeah.
Rather than in labor when you're fighting to not have an episiotomy.
If we can express that more about you think it's hard. I mean, you don't say it that way, but you think it's hard now to do it? Do you realize that you are going to be in the most vulnerable place you'll ever be just about in your life, and powerful, but you want to use that power for bringing forth this baby, not negotiating or what the worse for me, fighting for something.
Yeah.
So I think that is so, so important. And hopefully, though I've heard this as well, so we have to speak to the bigger picture of this. There can be very limited choices in some people's communities. There aren't a lot of care providers. There are not a lot of facilities. I have taught in a community where there is one hospital and not a good selection of care providers. There is one that people really, really like, but they have a partner that is the total opposite of them. So it's a gamble. It's a 50, and they only have one other partner, a 50-50 chance of getting that care provider. And it's, in that case, we are giving them their options and choices around how important their voice is, not asking for permission, being always willing to say, I am just making this choice at this time. I am happy to initial anywhere that you would like me to, saying I'm taking this responsibility, but I am not going to give permission. And my favorite story that I keep passing on is the woman who every time they came and they told her that she needed to do something, that it was time. Like, I think it's time that we start some Pitocin. She just very quietly went, no, that's okay, but thank you. And that was it. Each time they came to her with something, she just very quietly and very calmly just said, no, thank you. And nothing in the end ever happened to her, because how can you fight with somebody who is just saying, no, we're not going to, no. And I thought, that is probably one of the most effective ways that could work. Other times you have to be stronger.
Right.
So one last thing to add in, who also has to be very educated and know the realities and help make this decision or support this decision is their partner, if they have a partner.
Definitely.
Because the partner is very important in supporting that change also. If they need to change care providers or facilities, they have to support that person's choice.
For sure.
Yeah, so you're educating both of them. But in the end, we do the best that we can. We show them what we know. We help them find out what we don't know and what they need to know. And then we allow them to make choices. But I have the final note on this. I remember saying, I think I've already shared this. I usually share everything a bunch of times. But the woman who didn't want to change, but she wanted to change from doctor to midwife, but she didn't want to change because she didn't want to hurt her feelings. And she really wanted to go back to her for well woman care, but she really wanted to go to the midwives, which was her choice for the baby. But she didn't feel she could go back for well woman care to this doctor after ditching her for the birth. And she was going back and forth and back and forth. And finally, I just looked at her and I said, so let me be clear on what I'm hearing you say. That you are giving her more weight to her feelings than you are to your own feelings about this birth life experience you're about to undertake. And she said, okay, I'll change. And she did that day, but it was me just pointing out that she cared. She wasn't she was giving all her care to that care provider instead of realizing that care provider is nice, but she's going to have thousands of births.
Yeah.
And the hard part is you're just another person to her.
Exactly.
She likes you. And I also knew, and I was right. I thought, you're never going to want to go back to her for well woman care. You're going to want to go to the midwives for well woman care. And sure enough, that was her first baby. And then she went on to have a second baby with the midwives also, and never went back to that other care provider. Mm-hmm. So thanks, everyone. We have a tip in a moment.
Stay tuned and keep sending us questions. We love these. They're great.
Yeah, thank you. Yeah, so this may be a tip that lots of people know, but I'm amazed at how many people don't know this also, so I'm just going to pass it on. A really nice, smart idea is to carry in your birth bag some hydrogen peroxide. You can get the small bottles, big bottles at the dollar store or anywhere. It's so cheap. Carry that with you in your bag, and if you get blood on any of your clothing, you just squirt some of that on there. Better immediately than later, but it works even later. You put it on there, let it sit, and you can just pat it. Don't rub it, just pat it. And it's amazing how it's the protein of the blood attaches to the hydrogen peroxide molecules and brings it up. And it's just amazing to me how well hydrogen peroxide works. And I mean, having done so many home births, this is just really normal. Yeah. And I have been in situations where the family will say, oh, you might as well just get rid of those sheets, or, oh, get rid of that baby towel or something like that. And I'm like, no, it'll be fine. And they're amazed that it was because of the peroxide, really, that I would just pour it on there and then do the laundry and it comes out. It was also good for those who, with menstruation, if you have a overspill, whether it be your sheets or underwear, clothing, excellent for that. It's something that, my girls grew up with, just thinking everybody knew that, and they can't believe that everybody doesn't know about hydrogen peroxide, besides all the other many uses for it. Yeah. But yeah, so that's my tip.
That's great. Thanks.
Thanks.